success, transparency, and continuous delivery. That is our theme. We are Radency. We build digital products that people love. Networking and building relationships, that's why we are here. Thank you for coming. We are starting soon. We will start soon. This is the waiting room. Do you have questions? Put them in the chat. Health tech, software success, transparency, and continuous delivery. That is our theme. We are Radency. We build digital products that people love. Networking and building relationships. That's why we are here. Thank you for coming. We are starting soon.
Thank you, everybody, for coming. Well, that was the theme music. And we're going to be talking about, and I think this event's a bit more technical than a lot of the most of the events we've done in the past. We're going to be looking at transparency and continuous delivery. Sorry, I had to turn off the AI flamenco band. But I think it's also, we have a lot of people. We've got a lot of chief technology officers, a lot of software developers. We've also got a lot of people from the clinical side coming to this event. So people who aren't software engineers, and the product side as well, who are collaborating and communicating with software engineers. Now, I think, do we have my co-host?
They do.
Hello, Edward.
Hi, everyone. From Berlin.
You just in the nick of time, Edward.
Great.
So, what we're going to do, Edward, I think we're going to bring on our. We've got 3 speakers. We're going to bring them on one at a time. And my name is Jose Garcia. I'm a co-host, Edward. We both work for Radency. I'm more on the sales and marketing and webinar development side. And Edward is a delivery manager, solution architect, lots of experience in health technology. And so he's going to be my counterpoint. And I remember one thing I was really impressed when the first time we did a webinar last year, Edward, is your grasp of how to balance agile development, which is what everyone wants to do, especially in the startup scene, with healthcare regulations. That's not what we're talking about today, but
Right.
Now, without further ado, can we bring on our opening speaker from the United Kingdom? Thank you for coming. Hello,
Thank you for having me. Hi.
And I think you're a mate of one of our other speakers, Abby Holland. That's how I found out about you. I think Abby Holland, who's also from Toronto, at IDUN, she gave a big shout out to you on LinkedIn. And then I checked you out. I said, I want you on one of my webinars. And
amazing.
I'm wondering if you could just, sorry, that's a bit random. If you could tell us a little bit about yourself before we get in.
Yeah, I would be delighted to, and thank you, Abby, for the introduction. She's an amazing person, so great to hear about that connection. So hi, it's a real pleasure to be here. Thank you, Jose, for bringing me in, and thank you for everyone who's coming along to join the discussion. So my name is Sophie Valentine. My background originally is actually academic. So I worked in research for a number of years. I got a couple of degrees out of Bristol University, focusing on experimental psychology and cognitive neuroscience. And that was the direction my career was going in before I was bitten by the startup small company tech for good bug, and have found myself operating in that world for probably about 10 years now, ever since. I started out more focusing on the education technology in a really small startup, wearing lots of different hats, but ultimately found myself sort of spiraling the drain of software development and product management, particularly. Drain makes it sound a little bit more dramatic than it is. But I really missed the science side of things. And so I moved into the health technology space, which is it's obviously why I'm here today. And so I've worked in a number of companies since, at different ends of the spectrum. So I've worked in companies that are focusing on developing B2B SaaS, so tools that are sold into healthcare organizations, but ultimately developed from an outside perspective. I've also worked in a company most recently, actually, that was focused on delivering healthcare services ourselves, but developing technology in-house to really enable those services and kind of lean into innovation to enable quality and efficiency. So it's a space I'm hugely passionate about. And outside of that, I'm also co-founder and director of a nonprofit organization called NeurotechX, and we're all about pushing forward the neurotechnology industry. It's not exclusively to do with healthcare, but healthcare does come up quite a lot. So that's me in a nutshell.
Yeah, I've been following actually since I met Abby and Mark at IDON. I've been following the neurotech scene. It's very, very exciting actually what they're doing.
Yeah, yeah.
Can you open us off with why does transparency and continuous delivery, why is it important specifically in a health care context?
Absolutely. It's a really, really interesting topic. And just before I jump in, I want to make a clarification that I'm very much coming from a product perspective. I think a number of other speakers on the call will be more focusing on the sort of software engineering perspective, but I've got my product hat on today and have had it on for the past number of years. So taking the question transparency and continuous delivery, I'm just going to cut it in two and start by focusing on transparency. So again, just to kind of really give a definition, I think one theme that will probably come up quite strongly today is that both in terms of transparency and communication and collaboration, there's a strong theme of speaking the same language and kind of having words used by clinical stakeholders and sort of engineers and product managers and designers. Transparency might not mean the same thing to everyone. So for the next couple of minutes, for me, transparency means making sure that everyone who is ultimately collaborating around developing healthcare software has a really clear understanding of what we're doing, what's the context we're operating in, what are our objectives, and really the bigger picture, the why. So I think transparency is particularly relevant when we're dealing with health technology, because you have these almost hidden requirements of the software. And so what I mean by this is if you Google product Venn diagram, I'm sure a number of people on the call will have seen this, but there's the really famous, the three triangles that intersect. One is technology, so what can we build with software? One is business, what are the market needs? Where can we generate revenue from the product we're building? And the third is design/user. And people who have historically worked in software development will probably be really familiar with building products that are the intersection of those three, and they're fairly intuitive. You can look at market dynamics, you can imagine being a user. But when we're talking about healthcare technology, we have these additional complex areas that aren't particularly obvious, and that might be clinical and scientific requirements. It might also be regulatory aspects, and all of those are things that need to be sort of squeezed into the Venn diagram and don't really neatly fit in any of those first three circles. And because these things aren't obvious, if there isn't transparency, if there isn't clarity about all of these additional requirements, they may not be met properly if they're not communicated properly through transparency and clarity. So to give a really generic example, say I go to my carpenter and I want a desk, I want something to work on. And I say, please, could you build me a table? But I don't give the broader context of what I'm going to do the table for and why it needs to be, how it needs to be in my mind. My carpenter could well build a bird table, which is not going to solve my problem. It's not going to ultimately meet that requirement. And we see many examples like this in health, I think particularly, and I think we might touch on this later, when we start to think about AI, putting into a sentence what we're actually trying to build, it can be really quite difficult creating that level of transparency. So I think it's something that's really, really important to make sure those requirements are met. A second reason why I think transparency is particularly important in the digital health space is that there's a significant overlap between digital health and startups and scale-ups, and ultimately small companies that don't have a lot of resources and don't have really robust processes already established. What this means is that you have people who need to wear a lot of hats, and particularly for the people who are actually developing the software, they're very much stepping outside of their lane. So to take comparison with a company like Google, who has all of the resources in the world, you're more likely to have a situation where a software engineer receives really well-defined specifications and can execute on those specifications. And a lot of the agency and creativity is more around what actually is my code and what are the libraries I want to use to execute on these specifications. Whereas in startups, there's much more of an opportunity for engineers who are actually developing the software to lean into bridging the gap between requirements and specifications. And so again, having a lot of transparency around what we're doing and why is really necessary to enable that. Another thing is that a lot of the engineers I've worked with really enjoy that. They kind of don't like so much being in their lane and executing on specifications. They're passionate about the space that they work in and they want to get involved in the broader picture. So that's something that knocks onto employer retention and other factors like that. But ultimately, the whole thing really reduces risk around having lack of process and being able to flexibly execute on requirements and meet those requirements with the software. So that's my perspective on transparency. Coming briefly onto delivery, for me, this is something that, again, to give it a definition, we can broadly define as breaking development into smaller chunks that can be shipped and sort of iterated, and we can learn from that continuous delivery and testing and experimentation. So I know you mentioned earlier, Jose, that we might not be talking about agile versus regulations, but I think I might touch on this a little bit, taking continuous delivery as a sort of sign or signal of the broader theme of agile. I think digital health has had a really interesting history with this agile concept, of which one part is kind of shipping and testing and evaluating and iterating. I would say probably about 5 years ago, everyone was really excited about taking agile from the broader software development space and bringing it into healthcare. And then it all went a bit wrong and everyone panicked and thought we had to go back to waterfall. And now I feel that people are taking a slightly more nuanced approach where you can engage with all of the best elements and kind of combine them into a bit of a hybrid model. But yeah, the broader requirements in health when we're developing software, at one end of the spectrum, we have the fact that we can't just ship continuously and enable these experiments in situations where those failed experiments can cause harm. With healthcare software, when things go wrong, at the very worst case, people can die. And we have seen that with products in past. Something's gone wrong, a person or people have died. So we need to be really cognizant of not just shipping continuously and carelessly. But at the same time, if we lean back into that more waterfall approach of let's plan everything and then let's build it, there's a really good chance that we're going to end up with the wrong product and it won't really fit into where we want to put it in the market. It won't secure adoption with clinicians if those are the users, or it's just going to be really costly to redo the whole thing, particularly in a space like digital health where things are changing all the time. So there is really this need for experimentation and feedback loops. I think there's another reason why this is so necessary in the digital health space, which is that understanding user needs is really, really hard. Health is super, super complex. Getting to know healthcare systems and clinical workflows, and there are so many of them, and they vary by all of the different clinics and hospitals. It's a real challenge. I think we see a lot of companies who are SaaS companies, and so they're building technology to sell into healthcare. And so you have a natural separation between sort of the user, the person who knows most intimately the problems they're facing and what their workflow is like, and the group of people who need to really understand those requirements. So naturally, you're kind of, again, you've got that sort of sheet of glass in between the two. But importantly, clinicians are, in my experience, they're not product managers. They're amazing at being clinicians, and they're not necessarily amazing at putting on that product hat. They also have zero time. I think for any group of people, clinicians are certainly the ones that are most time poor. So being able to establish those touch points and relationships with clinicians to really get a good understanding of user needs upfront without that experimentation, it's just extremely difficult. And so in my experience, that's what leads us to really needing to find space for experimentation. I suppose the final question then is, how can we achieve that kind of continuous delivery, experimenting, learning without creating clinical risk? I think probably the major thing there is firstly to identify the safe experimentation areas. What elements of the software can we change where if something goes wrong, nobody's going to die, or there isn't going to be a significant additional, admin burden on the user if that's a clinician, as we know that additional admin burden on clinicians can lead to burnout, and that itself can cause clinical risk. And then aside from those kind of safe areas where you can just continually ship and experiment and learn and iterate, within the areas where it's not safe to do that, leaning as much as possible into experimentation, but just creating a bit of a ring fence around it, whether that be user testing in a sort of non-ecologically valid scenario, so kind of taking the clinician away from their workflow and doing a bit of user testing, or using sham data or sham patients. I myself have pretended to be a patient many, many times, and it doesn't matter if something goes wrong with the software, because I'm not going to act on the advice that I'm given by my clinician because of my awareness of the broader context. And you can also build in features that give sort of a safety net or training wheels when something does get wrong. So yeah, just to summarize, I would say that transparency ultimately ensures that we can meet the requirements of our software, while maintaining that flexibility on process that naturally comes with fast-moving, smaller companies operating in the digital health space, and really giving agency and creativity to engineers who have so much to bring to the table beyond just writing code. And then for continuous delivery, it's really all about overcoming those barriers to understanding needs in an area that's super complex. The needs are very specific, and if we get it wrong, there's really significant risk.
Myself, as my computer keeps on beeping, and I apologize about that. I don't know what's going on. Now, I want to ask you a question, Edward, in response to something what Sophie just said. And correct me if I'm wrong, okay? Is there a role that feature flags can play in this kind of rolling out of features and in a way that is safe and reversible? Or is that something that we should be talking about, or am I barking up the wrong tree? This is for Edward.
Yeah, first of all, I'd like to complete Sophie's answer regarding transparency. She mentioned about transparency to give more details as possible and clear requirements for the dev team. Also, I'd like to add, and we also discussed this before, it's to dev team should be aware of domain, and so it might be some kind of training program or something like that in order to prepare dev team to work domain they work with. And second, regarding continuous delivery, it's regarding audit and getting some reports in order to analyze. But in general, it was a really great answer, and I might borrow some approach working with
I got it recorded.
health
I got it recorded.
Yeah. Yeah. Regarding Jose, could you please repeat your question again?
Feature flags.
Feature flags, yeah.
Should that be something we should be telling people about? Is that a relevant question? Is that a way?
Yeah, feature flags, it's could be a part of continuous delivery as a part to increase the quality and to split the actual result. So if somebody want to tell more about this, let's give this possibility to this person. If not, we can back to this question in time to the webinar.
Okay. I'll tell you what, we'll talk about feature flags. I'm so glad that I actually got that right. I was just thinking about that when Sophie was talking. I'll tell you what, we'll bring it up in the Q&A.
Yeah, well,
Sophie, thank you so much for. Okay.
Pleasure.
And it's always good when you have an opening speaker who's got really good artwork in the background too. Excellent start. And if we could bring on our next speaker, and this is actually really dovetails really well. So I've met Hugo a couple of weeks ago, and I'm going to ask him to introduce himself. Hugo has been using transparency and a really good relationship with his user base to build in public and with almost minimal resources. And maybe I'm not representing you right. Why don't you, first of all, thank you for coming, Hugo. I'll let you introduce yourself.
Sure. Thank you very much, Jose, for hosting the event and having me. And thank you for everyone attending. So just in a few words, actually, initially I graduated from an engineering school in aerospace, so nothing related to healthcare at all. But I ended up actually doing a major, another master in bioinformatics and data science. So actually started to deal with health data, and I loved it a lot. I love the impacts someone can have in this industry. So I actually kept studying, but this time in entrepreneurship in healthcare. And actually, during my last year of study, I suffered some loss in my family related to cardiovascular disease. And this is where it led me to actually start investigating how to support patients on their cardiology disease care journey. And this is where I launched the startup Noctua Care, whose goal is actually to support patients who have gone through a myocardial infarction. So the idea is basically we support patients as they are discharged from the hospital during 6 months to a full year to make sure they get better quicker and they can stick to their treatment. And of course, so that's about me in a nutshell, and happy to elaborate on today's topic.
Unmute. Sorry, I've been muting myself because my computer just goes beep, beep, beep every time someone joins the webinar. And you think I know how to do this, but Zoom changed their UI, and now I'm kind of like at first base. Now, one thing I was really impressed that I want you to talk more about, Hugo. Well, actually, not more about because we haven't talked about it yet. Is how you leverage your relationship with your users and how you integrate those relationships into transparency and continuous delivery practices.
Sure, great question. So actually to elaborate first a bit on what Sophie introduced, so regarding transparency. So for me, there were two key approaches actually to the term. So first, to think about transparency in terms of communication with the users, with the different stakeholders, but you can also think about transparency from a software perspective, meaning that you implement some software which doesn't make any significant change in the workflow of your users. So those are two different definitions, but I think there is one common ground for both of them, which is trust. It's basically that in health, we are working in an industry of trust, and we need to build very early this specific relationship with both the patients, the practitioners, but also with other stakeholders, so our potential customers, mentors in the projects. On my side, so regarding Noctua Care, we have a very patient-centered approach. So for us, it was key from the start to make sure we involved patients in a transparent way in the development of the product. So how the startup actually started is following some my family experiences. I joined several patient groups. I joined some patient association, and I started becoming actually an active member of those organizations. And I actually started interviewing some patients to ask about their own issues, what was actually preventing them from sticking to their treatment, from following up the right path of care. And this is thanks to those interviews and the early relationship I built with those community of patients that I started to draft the first prototype for Noctua Care. And basically how it translated after that is that from the first connection with patients, I built a first community of practitioners. So basically I asked all my patients about who were their cardiologists, who were the nurses, the psychologists, the dietitians they trusted the most. So I built a paramedical team of nurses and practitioners that we started to build our platform with. Then I also got introduced to some cardiologists that were working with those different practitioners. So we built an extra layer of practitioners on top. And in the end, we also looked from some advisors, some mentors, some technical experts, and some potential customers or investors that wanted to support the development of the project. And that's the third layer we built on the product. And of course, the question that remains is how do we make sure to keep everybody involved in the progress of the project, despite them having different technical knowledge, different medical knowledge. And what we did is we built actually different communities. So we have a community of patients. So we have a group, a Facebook group with about 150 patients now, who are our key beta testers and users. We push them basically any update on our app on a weekly basis. We have also a paramedical team, so where we have all the nurses, all the dietitians, the psychologists. We try to interact with them on a weekly or monthly basis. And then we have scientific committees, which are bigger events where we basically draft our product and clinical roadmap. And we try to have those scientific committees every 3 months. So basically, depending on the level of intervention of every stakeholder, we try to have a closer or maybe a bit more distant relationship. But it's very important to keep it continuous. And so that's when we come to the second point of the question, which is why actually continuous delivery? Because to be transparent is to communicate about all the details of the project. But to build the trust, you need to be transparent, but you need also to prove that you.
Are you okay? I think we've lost you there, Hugo. Or is it just me?
No, not you. Hugo said something.
Hugo's. Oh, we lost Hugo. Oh no.
So
Okay, well,
our
he's
users
back.
is
He's back.
super important. Oh.
We lost you there.
Ah, you lost me. Oh.
When you talked about continuous delivery, why continuous delivery? You talked about the trust of the users. You froze at that moment.
Ah, sorry. Yeah, sorry. Yeah. Quite a non-stable connection. Sorry for that. No, so what I was saying is basically you need.
Oh no. Oh no. Well, let me add something while we're waiting for Hugo to come back.
Communicating to people on a radical, transparent basis is working well. Are you hearing me well? Is it still working?
You're coming and go. We
Okay.
caught that last half of that answer.
Sorry for that.
I'll say something. By the way, anybody who's listening, who's starting a project or is starting a company, what Hugo is touching upon there, it goes beyond software development, finding a niche community of users. Going to what that community is. Don't just post on LinkedIn. A lot of people just think, I'm just going to post everything on LinkedIn and that's how I'll find everybody. Don't rely on that. Find niche communities. I'm pointing at Hugo because that's where he is on my screen. Maybe he's not there on yours. And find niche communities and engage with them there. And I've got a question. Now, hopefully you can hear me, but I normally wait for the Q&A. But I've got a question for you that just came in. So we've got a couple of questions for the Q&A, but I want to ask you one right now. How impactful was the community of practitioners in terms of helping you grow the product in terms of acquisition? I think you touched upon that. It's really interesting approach to increase level of trust and engagement. So it's almost not just for software development. It's almost for it helps you grow your user base and your marketing as well.
Exactly. I think it's a super on-point question because first point is if you watch me, etc., and I send you a message on LinkedIn and I tell you download an app to monitor your cardiovascular health, I think the first response you're going to have is why? Who are you? And basically, you have no reason to actually trust me and support my project if you don't know my story, if you don't know actually the rationale behind the project. And so for us, That's what we faced as we started the project. Is actually when I first joined the patient groups, they're like, okay, with this guy who's trying to build a platform, an app for patients. He's not a cardiologist, he's not a doctor. Okay, he's an engineer, but he doesn't know anything about medical topics. So actually, yes, there was for me a decisive turn point, starting from the moment where we managed to have trustworthy practitioners on board, because right now, we had the first prototype with 100 users, which I recruited through a patient association and patient groups. And now we are planning on actually recruiting 1,000 patients, but this time through healthcare practitioners. So this time it's the cardiologist or the nurse that is introducing the solution directly to the patient. And it makes a big difference because actually what your doctor says, you are more likely to trust it versus what random people tells you on the streets. So for sure, it brings credibility to the project, and it also raises adoption rates from patients because I feel it's actually kind of a medication. If my cardiologist tells me, okay, this application is safe to use, there is no barrier for me to use it. So definitely a good question on that point.
Okay, I think let's see if I got one more question I want to ask you. And I know there's some more questions in the chat, but we're going to get to them in Q&A. Yeah, and I think you've already answered this, but
you want me to
does this
elaborate?
approach help you do more with less resources when you're starting up?
Yeah, exactly. To give a bit of context, so we are young startups. We are 18 months now, bootstrapped. So with a little bit of, I think, over 100,000 euros in funding. So we had some subsidies in France. So we're happy to rely on that. But by design, we need to be super savvy with our resources, which means actually two things. So we have two key resources: time and money. And actually, even though time is also money, because the more time you spend on something, the more money you need to dedicate to renting some office, to pay your servers, etc. So it's actually the same problem. We need to limit our cash flow, or to make sure that every euro we spend is a euro well spent. So for that, what's really key is to identify what are the features with the most added value for our users, to be able to prioritize them very early, and to be also able to test hypotheses and kill hypotheses very quickly. So that's why we started really with a no-code approach, saying so we work only on design, we work on functional prototypes, just to see, okay, is this really what the patients are asking for? Is it really what can be of use for a cardiologist? Or are we barking the wrong tree? And I think that's what's really important is not to start developing something, not investing money, which puts you at risk before you are 100% sure that you are working in the right direction. And so for that, of course, you need to be very transparent with your users, build the trust relationship, because you want them to be allowed to tell you that what you're doing is shit if it's actually shit. Because there's also a problem with that, is that if people don't trust you, they tend to say, oh, what you're doing is great, etc., but never use it in the end. So you need to really find those person who trust you enough to tell you, no, you're moving in the wrong direction, change the direction. And then, of course, you need to proceed with small steps, because we don't have the resources to work for 6 months on the new version of our app and releases. What we have resources for is to work for little increments over 2 weeks, provide it to our users, get feedback, and then try again, or kill a feature if we see it's in the wrong direction.
Very good. I think, by the way, if anybody has any questions.
I have a question. So
yeah, go ahead.
It's a good point regarding engaging the user community. And so you have like beta groups for testing each feature separately?
I'd like to say yes, that we have a very streamlined process, etc. The truth is, so we are a startup, we are doing our best, etc. So basically what we do is whenever we have something new, we just push it to our users. We send them emails, we write them posts on Facebook, we send them small questionnaires. But what's really, I think, the most important is basically we try to call them or to spend sometimes face-to-face with them to see them using the feature, get feedback, and see if actually what we planned is what we get. But definitely in the future, we'd like to say that, okay, we have some hypotheses with some criteria. We measure if the KPI is at the met objective, but we are not there yet. It's really something much more manual, I'll say, where we just try to spend time with the patient and see if they use the app the right way, if they understood it or not.
Yeah, great. Thank you.
If anybody else has any questions, put them in the chat. I think we're going to bring on we're going to slide Hugo off. We're bringing him back for the Q&A. Thank you so much for that, Hugo. And Phil, and I've been talking to Phil for since last year. We finally get you on a webinar. And I wanted to ask you, before we get into the weeds, if you could respond, kind of like the respond to the Queen's speech kind of thing, to what the other speakers have said. Is there anything that you picked up on that you want to add 2 cents? Oh, first of all, I should ask you to introduce yourself. Sorry, we're getting ahead. Sorry. How about you introduce yourself? Sorry, I know who Phil is. Other people don't know who Phil is. Why don't you introduce yourself?
by all means, Jose. Jose and my paths crossed. I don't remember where. There's so much noise on the internet, so much information. Even with 3 27-inch screens, it's still quite difficult to consume even a fraction of what's out there. So I'm Phil D. Hall. I was Phil Hall until the internet got really busy, and then I put a D in and sort of rebranded myself, so I'm a little easier to find. I entered the internet in 1997 doing an ethnography in a virtual world as an anthropology degree, and it's really cool to be part of this group of people, Sophie and Hugo, who clearly had that view of social science and sort of core ethnographic principles, and trying to wrestle that into software development and the kind of the outrageous hype cycle, which we're in more broadly with what artificial intelligence is or does or so on. But my initial contact with conversational AI, which is my specific interest in the 3 pillars, and the 3 pillars as I perceive them and explain them to clinicians and others, although I'm pretty much focused on healthcare myself and the team of people I work with, is RPA, robotic process automation. That's not really AI, but people like to call it that. Computer vision, or whatever you want to call that. Again, these things, neither of these are new. And the 3rd pillar is conversational AI, and I've been delivering that professionally for 25 years now. Originally in email response management systems for a systems integration company, and then working from there into Elsewhere, which is my core company, which started in 2002, and I've built over 100 systems with best of breed technology. And I think that, I'm going to sort of leap onto your question, Jose, because I'll explain a bit about my journey as we go through the conversations here. But the bits that caught me from Sophie and Hugo's talks was about, on the one side, the kind of difficulty in AI adding words, and that kind of, well, that's truth. What is it that AI is saying or doing, and how do you use AI, and where even does the AI come from? The kind of, the AI which you get out of large language models, of which Hugging Face now has 786,765, because I just opened the page here. Who owns those words? Who actually, legally owns those words, and how are those words going to be configured? So I think that kind of difficulty in AI adding, but equally the difficulty in how we deal with AI, is something that I'd like to just sort of bring into my part of this webinar, because you're absolutely right, Sophie, people can die. If somebody comes up and says we don't need any radiographers, because a certain part, one of the 3 pillars, is accurate enough and there's no radiographers, and then people don't have a radiographer working with them because there aren't any, that's a problem. That's a major problem. And it sort of fits into the hype cycle. But equally, to stay with the 3 bits I pulled from Sophie's, that kind of finding space for experimentation and shackling the people that are chasing, augmented general intelligence or even GIA, all this synchronicity, doom and gloom stuff is important. But I'm hoping that, particularly with people like the MHRA, who did a snappily named webinar earlier on this week about an AI airlock, which I thought was just completely HAL 9000 kind of close the Bombay door stuff, airlock door stuff. The governance piece is moving really quickly. So I think that Sophie spoke really beautifully to that. And I think bringing that passion and interest, and also coming from a social scientific background, is great. It's great to hear. It's great. And I totally support people who don't come from a purely statistical gambling point of view, because I've been using best of breed technology for over 20 years. And then within your work, Hugo, in Paris, again, really good to hear. It's good to hear you stepping out the no code, low code approach. I do struggle a bit with that on the basis of developed systems. One of the major voices on the internet came up with the latest in a long line, AI mastery in 45 minutes, which was like, okay, well, on the basis that AI has been around for at least 45 years, you're not going to learn it all in 45 minutes. But stepping out, Hugo, into the market, going to listen to people and to identify what are the building blocks and the pathways, is a super good thing to do, because those kind of prototype and logic and structures and how they work according to the delivery of AI support, is something that's really important. And of course, what you're doing is very ethnographic as well. Going out, talking to people, listening to people, and then blending those people together. And I can speak to that a little bit more, Jose, on the basis of what we've chatted about. So that's my approach to the Queen's speech, or even the King's speech nowadays. Although that sounds a bit wrong to my ears, but Jose.
It was interesting when you said that. I want to add one thing. I went to a webinar last week where a doctor was talking about AI, and I started asking him questions, and I realized he was just talking about, if the patient has this, then they get this message. And I thought, that's an if statement. That's a decision tree. That's saying that that's not AI. So a lot of people, they're almost thinking that AI is everything now. If you have this, then send the user a letter. That's not AI. But because of the conversation people have been having for years, it's been muddled up, I think, a lot. But I don't want to sidetrack the conversation. If you could share an example, Phil, I know you've got a lot of experience of how transparency and continuous delivery made a big difference in a project that you were working on.
Well, I think the transparency and continuous delivery and the ability for us to work with something in between agile and waterfallers was flagged earlier on. Although if you go back to the mid-noughties, it was called RAD, rapid application development, but that was at the same time as knowledge management was around. And there's a lot of lessons that I think we can learn if we go backwards, not just in time, but also in time and method. And I would just flag one guy, a guy called Professor Nigel Crook from Oxford Brookes. There's a British Computer Society video out there that's worthwhile looking on the basis of the cost of compute and the ability for generative AI and declarative AI in a hybrid position, which is what I mean as hybrid, but the words are so messy, Jose, as you know. he's a good person to watch. But equally, go and have a search about if people fancy an interesting side to look for Artificial Gamer, which is an MIT piece about early days of OpenAI before the Microsoft commercial relationship, for want of a better term. But so there's some interesting stuff that's swimming out there. But how do we focus on something which is of value and an example of transparency and continuous development? I think there's probably sort of 4 steps here, and it takes me back to a system that was built in 2008 to 2011. It was built with the funding of Bechtel in the UK before it was destroyed by a now exited the government and politics individual. And what we did was we built a conversational AI system with kids, with Key Stage 3, Key Stage 4 in the Bristol area, looking for English reading and writing. And we dabbled in mathematics, and we built this system on a thing called an AMIO, which was like a PDA. We built it over 3 iterations. We worked with the city learning centres. We worked with the students directly, with the staff directly. We got into the after-school clubs, and we were moving in real time. And what we bought out of that as a system, unfortunately, Bechtel was dissolved, and the money which we'd used to build it, which was around $250,000 over 3 years, it sort of dropped away. And the technology I was using at that time also dropped away, but an open source core appeared, which I still use to this day. So what we drew out of the TeachBot system was behavioral methodologies. We were looking within it to identify, on the basis of keystroke input, the way that people were talking, how they were talking, concatenate the delivered output, because it's not just question and answers. So I think that came from us being able to show exactly what the system was doing. That was before regression harnesses, which I'll hopefully get to in the limited amount of time we've got here, Jose. We moved forwards from that about 10 years ago to a system utilizing this open source core, and it picked up on personal identifiers, Bloom's taxonomy of thinking, Colburn Fry's experiential learning cycle, and the most recent healthcare development, which I've been involved in, funded by the NIHR, a system called ROMI, was using COM-B as the core methodology: capability, opportunity, motivation, leading to intervention functions, to behavioral change pieces leading to policy. But that group of people, as Sophie and Hugo were also flagging, are a mixed group of people: clinicians, academics, linguists, C++ coders, so on and so on and so on. So I think that the examples of transparency and continuous delivery actually feed through everything that I've done since the mid-noughties to the current day. And the ROMI work and the work we're doing purely in generative AI in training for motivational interviewing fits together. Main thing is engage with the people and the transparency of the system. And then we hit the big elephant in the room, which is that if you've got a model that you're relying on and somebody's tweaking that model and you don't know what's happening to it, and you're trying to run it through DTAC, every time that model changes, do you have to reset it for DTAC? Is it a new medical device? But more importantly than that,
DTAC is UK.
Yeah, UK based. It's a regulation which is about the amount of technology. It's a definition of technology. It's a badge of sorts. And this AI is a medical device piece, Jose, which came out from the MHRA yesterday, having been paused for PERDA, which is because the UK government has just been replaced and so on. So I think that the examples are manifold, but you can distill it down into transparency and visibility of what's moving in real time. And the problem, and it's not a feature, hallucinations are not a feature. I don't care what Sam Altman says. Hallucinations are false positives or false negatives, and identifying that and working out whether you should even be using generative AI or not. And if you should, whether you should be using it for real time, and the answer is definitely no, then you're in a position where some of the noise, some of the bubble, we can actually discard. Yeah, that was a long answer, Jose. You're never going to cut that down into 2 minutes, fella.
You'd be surprised what I can do in the editing screen. There's a link to ROMI in the chat. You know, we're running out of time. We're really running out of time. I actually got, Edward, is there anything you want to respond to what Phil just said?
Yeah, I just want to add, it was a great answer. Just to add that generative AI is a good choice to use for increase continuous delivery. It's increase the performance, but sometimes it's a bottleneck for using as a transparency because it again, some basic rules you can't control. Sometimes you can't see and audit the details of implementation, especially if you use like open source tools and so on.
Can we bring everybody on? Because we've got a question from Diana. I'm wondering if everybody can take a kick at this can really quickly. This is from Diana, who's a regular attendee. She's a compliance officer for a health AI company. Regulatory here. How can I motivate my startup colleagues to be more transparent in the documentation, taking into account the limits of time and resources? And I think, Sophie, can you go first?
Yeah,
Okay.
I would. I would absolutely be delighted to. I think, I mean, it really, in my experience, I've worked with a number of different teams, and it all depends on your team and their attitudes and their approach. I think one thing I found in my experience, particularly in really small startups, is almost separating the transparency from the documentation. Documentation takes a really long time, and if you're running quickly, you may actually be able to get away without doing it. If you're on the kind of regulatory compliance side, that may well not be the case. But I've certainly worked with stakeholders who've said, I don't have time to write it down. And the response is, that's great, we don't need to write it down, but we do still need to enable that transparency. So I would say kind of three approaches come to mind for me. One is around making clear to individuals what the risks are if we don't lean into transparency, just painting hypothetical scenarios of what could actually happen. You can steal my silly example of getting the wrong table. But once you start to scale that into healthcare, it really makes clear why it is necessary. And I think it's important to explicitly close the loop with colleagues on that. I think another one is generating empathy for your colleagues. Again, in a small company, we're all running so quickly. It does take a little bit of time and effort to almost step out of your own head and recognize that everything I know is maybe not everything you know. So really building those empathetic relationships, I think, is a kind of foundational factor to that. And then the third thing I would say is just using really practical techniques and encouraging teams to lean into particular tips and tricks. So for me, I love the grandma test. So when you're explaining something to someone, you explain it as if they were your grandma. Who's a person who hopefully you love, and so you really want them to understand, but also you don't have any assumption of shared context, and so you're really willing to go back to the basics. Something else I've got a little bit of a reputation for in my work is using lots of analogies to explain things, and pulling out really silly examples to just make sure that we are all on the same page. And all of these things are a little bit fun as well, which makes what can be a little bit boring documentation transparency over explaining into some fun, enjoyable activities that you can use with your team to really help build their relationships on top of generating transparency.
Phil, I feel bad because we kind of ran out of time while you were talking. I don't know if do you want to add something?
Oh, I'd love to. Unfortunately, having spent so long in this market, there's an enormous amount to say. And I've recently was involved in a University of Bristol obesity workshop with a brilliant group of people, clinicians, psychiatrists, psychologists, active and practicing people, and the bulk of them, because with a senior researcher called Joanna McLaughlin, who's and a guy called Mark Bailey, both these people you should keep your eyes open for. It was able to go, we don't know. I think to answer directly to the question, Sophie positions it really well. Documentation takes time. I think sometimes you need to go sideways. If you approach the documentation on the basis of your quality control and build regression harnesses to control the development of the software, which is problematic in pure Gen AI, but works in a neuro or a hybrid system, then you have that documentation built into the testing, and the testing then improves the quality, which allows for clinical outcomes. Point one. Point two, an IHR due diligence, you've got to run through those hurdles, yeah, or somebody else's due diligence. You've got to ensure that the chief data officer, the ICO's in place, the safety, all of that stuff. And that needs to be approached not just from a technical side, but from a clinical side as well. And the governance piece, particularly with the new government in the UK, should be interesting. Yeah. Third piece, stand-ups, get people involved so that the version controlling is done. And when stand-ups start, do them like you should do. What have I done? What am I doing next? Who's blocking me? No noise, no nonsense. Yeah. People who need to have like comfy sofas and ping pong tables and so on to be able to work for a living. That's not working. That's relaxing. Yeah. There's a bit of a line as a grumpy old 60-year-old. Right? There's a bit of a line of like you come to work. Yeah. You can use some of the large language models on the basis of helping work with code directly or with documentation, particularly the summarization piece. So bear that in mind, but bear in mind it might be hallucinating. Yeah. I actually work with I've been trying to train a co-pilot in the open source system. Yeah. And that's an interesting wriggle. Yeah. Yeah, I could say so much more, but I won't, because I think Hugo's definitely got some value to add here, Jose. So I will.
I got a 2-minute clip there, Phil. Thank you. Hugo, can you add something?
Sure.
But can you do it in 60 seconds?
Yeah. So for me, actually, the question seems pretty paradoxical because transparency is the silver bullet to actually saving resources and time. And it's actually the best investment you can make today for your future self. Because there's nothing better than to get back on something you've coded 6 months before, 1 year before, or maybe another colleague started to work on, and to have everything explained because it has been documented and written. And just a few words, actually, there is a French unicorn in France where I used to work, which is called Alan. And what is amazing about them is that they have radical transparency as one of their core culture principle. So the company was started in 2016, and since then, everything they've done was documented in a written manner. So it means they try to avoid live meetings as much as possible. They use asynchronous communication, documentation. And it means that today, if you join the company in 2024, you can access actually all that information from 2016 to know why they created the company, when, how they coded stuff. And that's amazing resources. So basically, invest in your assets today for your tomorrow's benefits.
That's brilliant. Okay, we got 60 seconds left, Edward. Is there anything you want to add?
Yeah. Can you hear me?
Yes, 60 seconds.
Yeah, okay. First of all, I would like to add that I missed about what Hugo told and Diana's question. If you're talking about transparency and continuous delivery, it's like kind of hybrid agile waterfall approach. Like you could use initial planning and documentation which follow a waterfall approach, but then you can switch to agile and have a flexible development and testing process. And the second one is regarding feature flags. I promised to mention that it's both important for transparency and continuous delivery because first of all, it's give you control to rollouts. You can use feature flags to gradually roll out new features to a subset of users. You can increase your A/B testing. You can have emergency rollback, which is also part of transparency. You can have you can demonstrate the progress by enable some features to separate group of people, which also increase your trustworthy for users or stakeholder management.
Okay.
And I'm done.
Thank you. Well, that's going to be great for the clips. Okay, so thanks everyone for coming. We're going to kick you out now. If anybody wants to talk to me or me and Edward about either a future webinar or a future health technology product, or you just want to network with me or talk about webinars or anything you want, just ping me on LinkedIn. Thank you so much for coming. If the speakers can stay, and then we're going to if Nuri, if you can kind of boot everyone else out. Thank you so much for coming.
Bye.
I really
Thank
enjoyed.
you. Thank you.
Thank you so much. I really felt like we ran. I wish we had another half hour there.